JamiaTV, Beacon for the Nation. This program is suitable for general viewing.
أهلا وسهلا ومرحبا بكم والسلام عليكم ورحمة الله وبركاته. It's the 29th evening Thursday of January 2026. Good evening and welcome to Live Real Talk Show. My name is Zamzam Ahmed. Good oral hygiene is essential for preventing common dental conditions, yet it is often overlooked by many until when discomfort or pain strikes. And many people, which includes me, we tend to seek care when it's too late and simple issues become more serious. Sometimes we ask ourselves, is brushing our teeth twice a day or thrice a day or maybe after every meal good for our, is it part of our oral hygiene? How are we going to maintain our oral hygiene? And in studio tonight, I am joined by Dr. Nasruddin Ahmed, who is a dentist and will help us understand more about oral hygiene and the common dental issues and the practical ways to manage them effectively. And they say an informed conversation is or can lead to healthier choices for you, for your families, and everybody. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam, Zamzam. Thank you very much for having me on this evening.
It's a pleasure.
My name is Dr. Nasruddin Ahmed Shire. I'm a general dentist and I work at Ummah Medical Center. I graduated from Gulf Medical University in the United Arab Emirates in 2020 and subsequently finished my internship there and became fully licensed as a general dentist here in Kenya in 2021.
MashaAllah, amazing. And that is why we have you here tonight to help us understand why is it important for us to maintain our oral hygiene. And perhaps as a dentist, maybe I can ask approximately how many patients do come visit your dental care, and what are these, or maybe what problem do they complain about?
From my history as working as a general dentist here in Kenya, the numbers always range depending on the season, depending on the time, depending on whether it's a holiday time or whatever the case may be.
Okay.
But in general, on average, we usually see about 5 to 10 patients per day. Of course, sometimes the numbers can increase drastically or can reduce drastically.
Okay.
The most common dental issue we usually see when people come in are cavities.
Okay.
And cavities are basically a hole in the tooth caused by bacteria as well as lack of good oral hygiene. These cavities usually begin as benign, reversible small holes and progressively increase in size until people feel pain. The time people usually come to see us in our clinics is usually when they feel pain rather than before or during regular checkups.
Okay.
So that's our major type of problem that we see in our clinics. The second issue we usually see is with children, and that's the problem of malaligned teeth or crowded teeth or sometimes missing teeth. There are several ways we can deal with them. There are several ways that we can approach these kind of cases, and it's usually a multidisciplinary approach where we work with orthodontists as well as pediatric dentists and sometimes maxillofacial surgeons.
Okay. Now, because I've mentioned earlier in my introduction that is good oral hygiene is essential for preventing common dental issues or conditions. Perhaps as per you, why is it important for us to maintain or oral hygiene is important to us?
One of our most important slogans in our dental clinic is prevention is always better than intervention. And now we can ask the question on how we can prevent all of these dental issues. The major approach that we usually say is that our patients and people in general can brush at least twice a day, once in the morning and once in the evening before they go to bed. And the second thing that they can do is use a dental floss, whereby they use a thread and thread that floss in between their teeth every single night to remove any kind of food and any lingering debris that's still stuck inside.
Okay, you've mentioned about the common dental issues that most of the patients normally complain about when they come to you. So in general, what are other dental issues or dental conditions that we hear?
Apart from the dental cavities, which I might say is not only myself, but it's regarded as the #1 disease worldwide. Some people may undermine the problem with dental cavities, but it's the #1 issue, followed by malaligned teeth. And thirdly, here in Kenya specifically, there's a problem of fluorosis, whereby since the water in the wells here, as well as the Nairobi water, isn't regulated, the fluoride inside isn't regulated, the high amounts of fluoride typically can cause fluorosis, whereas a regulated amount of fluoride can actually prevent dental caries, which we see in other countries, such as where I'm from in Canada. The water there is regulated at 1,000 parts per million of fluoride, and that's one of the ways that the government there also minimizes and manages dental issues.
Okay, and why is it that many people wait until they feel this pain before visiting a dentist? And we have you here.
One of the issues I would say is the lack of information and education, which I hope my presence here and our interview here will shed some light on, inshallah. And so the problem with neglecting or waiting until you feel pain is by the time you go see the dentist, it's already too late. The cavity has already reached the nerve of the tooth, or perhaps even further, and it might require an extraction. My recommendation and the recommendation of dentists worldwide is that we visit, I myself as well see my dentist twice a year, every 6 months, where I do my own cleaning and checkup as well. The advantage of doing that and doing that preventive and also prophylactic approach is that your primary healthcare provider can tell you that a cavity is beginning to form. And there are several ways that we can reverse these dental cavities before we need to pick up the drill.
Okay. Okay. When we talk about oral hygiene, it's only something that is from our mouth, right? It's only the mouth.
Yes.
But when you have a good oral hygiene, it also affects positively our overall health. So how is oral hygiene related to our overall health? As
our oral cavity is attached to our body, it's not separate to our body. There are blood vessels that lead to our teeth and the bones in our face. There are nerves that also approach the same way, as well as there are lymphatic drainage system that also goes to the same place. Our mouth, like the rest of our body, can be affected by disease, and neglect of those problems can lead to other problems throughout our whole body. One example is infective endocarditis, which is an infection in the muscles of the heart. This can come from sometimes a dental infection, and that infection travels through the bloodstream along the vessels of the arteries and the veins of our body and lead to the heart. And that bacteria can travel from our mouth all the way to the heart and lead to that issue. So that's one of the ways where our mouth is connected to the rest of our body. There are some cavities that develop abscesses as well as swellings around the tooth. And without proper treatment or treatment in the right time, those swellings can also propagate as well as spread to other places and become potentially devastating and dangerous.
Now, how is it helpful for us when we are advised to be brushing our teeth maybe after every meal or maybe twice a day?
The best recommendation from the World Health Organization is to brush twice a day. If you would like to, you can brush more, but it is not advisable to brush harshly or to use hard bristles when you're brushing, because that can lead to other issues. One of the issues that can lead to is recession of the gums, where the level of the gums recede and teeth appear to be longer. When that happens, the bone as well supporting our teeth can also recede as well, leading to potentially tooth loss over time.
Okay.
So we would like to work and meet in the middle. That's why we recommend brushing twice a day, once in the morning, once in the evening, and to floss at least once a day as well.
Okay.
By doing that, you cover all bases and do your best to keep your mouth clean, as well as to have a healthy and very nice smile.
Okay, clarify something for me.
Yes.
We used to hear before, when we were in primary school, like you brush early in the morning when you wake up,
Yes.
or others normally say brush after every meal,
Yes.
like after the meal. So which one would you recommend, and why is it so?
With dentistry, since it's under the umbrella of medicine, with new technology and new studies, we develop new techniques on how to maintain our oral hygiene. One of the ways previously was by telling people to brush after every meal. Of course, there's nothing wrong with doing that. It's just that it may lead to other issues if you do brush several times a day and you do it very harshly, and it can lead to other problems. So that's why we'd like to meet in the middle, like I said before, and just brush twice a day, once in the morning and once in the evening before you go to bed. When you do brush in the morning, I would also recommend that you do it before eating, not after you eat, since the acid can also spread around your mouth once you brush, but it's better if you brush before, you won't really spread the acid of the food around your mouth as much.
Okay, sometimes at least you've clarified something for me, because that is something that has been in my mind for so long. People normally say brush after meal, but when you wake up in the morning, you brush before everything.
Yes.
And that is good, by the way. Now, something else is about still on brushing.
Yes.
Some people tend to brush their teeth, but during the day they happen to have bad breath. Why is it so?
Bad breath can come from many issues and many causes. The first cause that usually, the first problem that usually causes bad oral health or a bad oral smell or halitosis is usually the bacteria that lingers on our tongue. So when you brush, you should brush your tongue and make sure you reach as far back as you can to remove any plaque as well as any bacterial biofilm that accumulates either over the night or during the course of the day. So one of the ways to reduce that bad smell is to brush your tongue. The second way to reduce the bad smell is to use a mouthwash at least once a day. And that mouthwash also kills any potential lingering bacteria that's in our mouth that's causing the bad smell. And the last thing is that you should see your dentist and do cleanings or scaling, as we call it, every 6 months. As the plaque and biofilm build up around our teeth, it becomes difficult, and I'm sure maybe you might have noticed as well, Zamzam, you might say, I brush every day, you know, I take care of my oral health, yet I still have bad breath, or I still have calculus around the gums of my teeth. So when that happens, the only way to remove that is to go see your dentist and remove that smell and also the plaque. The number one cause we usually say of bad oral smell is periodontal in nature, so meaning it's part of the gums, you know, the tongue as well, and the surrounding supporting areas.
Okay, there is something else. It concerns when we feel discomfort or when we feel pain, maybe issue dealing with the cavities, right? And most of the time, people think that removing the tooth will be a solution, will ease their pain. So as a dentist, is it something that it should be done, or there is another way?
Yes, that's a very good question. With every single dental issue, we have a set or a number of possible treatment plans that we can use to solve the issues that we have. When it comes to dental extractions or removing teeth, we tend to look at them as the last resort and not to do it as a first resort and first option. Of course, there are certain cases where in order to treat our patients and the people that come to see us, the only way to help them is to extract teeth. With current technology, as well as the materials that we have today, of course, it's a lot better than what we had previously, the past 50 years, 100 years. However, nothing comes close to what we have as our natural teeth. That being said, if there are no other options, we have to remove teeth. If there are other options, I myself always recommend to my patients that we can do X, Y, Z rather than extracting the tooth. Of course, extractions are easy, they're fast, sometimes they're also more affordable. And we have to always also look at that as well, because sometimes people might not be able to afford other treatments. And of course, our main priority is to help our patients and to respect as well their wishes. When it comes to extractions, like I said, the reason we say it's a last resort is because without proper follow-up treatment, it can lead to other issues. When we have a tooth that's lost, the adjacent teeth, left and right of it, tend to lean and tilt towards that space over time. They don't tilt in a way that closes the gap properly. They rather tilt and face each other, slanted, exactly. And over time, they lead to other issues, as well as the opposing tooth as well tends to over-erupt and grow longer as a result of not having a tooth in proper contact with it. So that now leads to other issues. We have to now get braces, do orthodontic treatment to align the teeth. However, if we do then an extraction and replace it with an artificial tooth, such as a dental implant, whereby we place a titanium screw in the bone and attach a artificial tooth on top, or the second option would be to place a dental bridge and close the gap. So extractions, yes, we do them. We do a lot of them. Of course, if it's a baby tooth, a deciduous tooth, and the permanent teeth are coming out, of course, we extract them. You know, sometimes our parents can't remove the teeth as easily, or they're coming out in a wrong manner, so we have to help them in that way. But as long as we do the follow-up treatment, it will lead to a positive outcome.
Okay. Oh, thank you so much. I think we are going to take a break. But we will be back with more, because we have braces lovers, you know. Those people who like putting braces. Others put them for fun. Others put them to just brighten their smile, something like that. But we'll come to that and understand more, or how is it something good, or is it something that can affect our lives. Therefore, don't go far, because we will be back with more on the same. And we say good oral hygiene is essential for preventing common dental conditions. Stay tuned.
JamiaTV, beacon for the nation.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu. Hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa,
ili uzidi kujenga imani yako na kupata faida nyingi ya
katika siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on
JamiaTV.
Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم.
المال والبنون زينة الحياة الدنيا والباقيات الصالحات خير عند ربك ثوابا وخير أملا.
JamiaTV, beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back and thank you so much for keeping it at Jamia TV. This is our second segment of live real talk show. My name is Zamzam Ahmed and tonight it's all about good oral hygiene with Dr. Nasruddin Ahmed. From where we left, Dr. Nasruddin, you've mentioned about dental extraction being the last option, perhaps for a person who has been having these kind of issues for maybe quite some times. So you've mentioned about solution XYZ. Perhaps what are these solutions XYZ that you've mentioned?
Thank you so much, Zamzam. When it comes to solving dental issues, the first step is to have a correct and proper diagnosis of what the issue is, and to also find out the underlying causes of that issue. And the best way we can do that is by doing a proper investigation. And the number of ways we can do that is by doing an oral examination of all the teeth, not only the tooth that is bothering the patient, to examine the patient as a whole as well, and to do several dental x-rays. What we see visibly with our eyes is only the top part of the tooth. However, there are roots, there are bones that we can't see, there could be potentially underlying issues that we can't see. So the best way to solve these issues is to have a proper diagnosis. Once that diagnosis is determined, the ways we can treat the teeth are by determining the grade or severity of the cavity and the extent of how much tooth loss there is. If there's a small amount of tooth loss and it hasn't reached the nerve and the patient isn't feeling severe pain constantly with or without external stimuli like cold drinks or hot drinks, then the first thing we do is a dental filling. There are several different types of materials that we use in our clinics for filling teeth. Previously, we used to use silver or amalgam fillings, and with new technology as well as new materials that have come out the past few years, we have slowly shifted from moving those silver fillings to now tooth color or composite fillings. That is for small grade tooth cavities without an extensive tooth loss. The second step, if we can't do a tooth filling, is to do a root canal treatment. And a root canal treatment is usually done when a tooth has a cavity that has reached the pulp or where the nerves and blood vessels of the tooth are, and we have to clean inside and reach the end of the tooth through using dental files, microscopes, as well as several different intracanal medicaments or medications that we use inside the teeth. If the extent is too far or the tooth cannot be treated, then our last option, of course, is to do an extraction. I'd like to add that sometimes when we fall down or when people fall down, the teeth their teeth either might break, there might be a fracture in their bones supporting the teeth, and depending, of course, on how bad it is, we would do either a filling, a root canal, or an extraction as well.
Okay.
Yeah.
Okay. Sometimes we tend to have mouth sores.
Yes.
Most people complain about mouth sores.
Yes.
What causes mouth sores?
There are several different causes for mouth sores. If it is inside the mouth, it could be caused by a variety of different things. Of course, if you have something that is extremely hot, it can cause a mouth sore or an ulcer. If you are eating something that is potentially sharp as well, or you don't notice, let's say you're eating some meat and you accidentally bite into a bone, and that bone pokes you inside your mouth, it can cause a sore. And the last thing, or one of the other things that can cause a mouth sore, would be stress. And that's something that some people might not know, that if you are going through a time of high stress, that it can lead to ulcers. So when we determine what the cause is, then we would follow up with the appropriate treatment.
Okay.
Yeah.
Okay. Before we took a short break, I mentioned about braces lovers. Those people like putting on braces.
Yes.
Going to a dentist, asking the dentist to put braces to their teeth. So as a dentist, is it something that you would recommend?
Yes, but of course it depends on what the case might be.
Okay.
When we have people with crowded teeth, they find it difficult, or they may potentially find it difficult to properly clean their teeth. When teeth are overlapping each other, there are some gaps and areas where food can build up and bacteria can take hold, and it will be difficult to clean. And potentially down the line, it might lead to dental cavities between those teeth. So we would also recommend that those kind of patients, that they can get braces and resolve that issue. Once we have a clear and healthy as well as aligned teeth, it can lead to proper chewing, and also lead to proper sleeping habits as well, and also lead to a healthy smile, which then might increase or make them feel better perhaps. So when it comes to braces, one shouldn't do it just because they want to do it. They should do it because they have an issue and it needs to be treated. And the next thing I would like to talk about braces is that you should always go to a licensed dentist or an orthodontist who is specialized and spent several years studying braces extensively. When we go see other people that might not be properly trained in orthodontics or in braces, it might lead to issues. When we move teeth, we're also moving bone. It's not a simple procedure, and it's very delicate. When one uses severe forces to move teeth, or they don't use the proper technique in moving the teeth, it can lead to the teeth becoming very loose and eventually becoming lost in the process. So when you go see your dentist, make sure that they are properly licensed, that they have a good conduct with the KMPDC board, the Kenya Medical and Dental Practitioners Council, and they should be in good standing with them. We have seen many cases, I have personally seen many cases of patients going to other dentists or not even dentists.
We also have the previous scenario.
Yes.
And it really shocked me to see that something small can really cause the life of a person.
Yes, yes, but you're talking about this previous case. It's a very sad and tragic story, and it's a lesson that we should all learn from and make sure that it never happens again. You know,
But how would I know that the dentist or this clinic is really authorized?
That's a good question, Zamzam. And I'd like to applaud the KMPDC board and their drive to really make sure that dentists and also medical practitioners are properly licensed. And one of the ways they do that is by having a website whereby you can search the individual's name and you can make sure that that person is licensed. The second way you can make sure is by asking to see the dentist license, and it is your right to see the dentist license and to have it displayed. And there's usually a barcode that's there, and you can scan it with your phone, and that would usually lead to the KMPDC website and let you know if this person is licensed.
Okay, that's nice. But you know, the current situation is that people tend to look for money, just making money, not looking at the service they will be providing to the community. And it's true that through online we can also check if this clinic or hospital or anywhere it is licensed. Okay, thank you so much. I think when we talk about, let me take you back to the braces. So most of the time, some people normally complain that these braces also affect them. What's the effect of having these braces, the negative effects?
The negative effects of having braces is that it is a foreign substance, a foreign body attached to your teeth, and it is an extra layer of a surface where bacteria can attach to. So by increasing the surface area of potentially places where bacteria can adhere to, you have to now find ways to clean them more often. And what usually happens, and it is a bit unpleasant, is that once people put on braces, they either treat their teeth the same or treat it a little bit worse than before, and that leads to now several cavities in between the teeth. It can lead to, again, bad oral smell, and it can lead to several other issues. So when we do braces, we also give a list of things what the patient should do and what they should avoid to do, and how they can properly maintain their teeth such that by the end of their treatment, they are very happy and they leave with a healthy smile.
Okay, wow, amazing. Now, we have the key things or the things that we can do, the habits. Perhaps if I may ask, how or what daily habits play the biggest role in maintaining good oral health?
Yes.
Apart from brushing twice a day as your recommendation.
So apart from brushing and flossing, the next thing we can do is to limit the number of times we snack. And by snacking, I mean eating crisps, eating sweets, eating chocolate. Of course, everything is fine in moderation, all right? As long as we take care of our teeth at the end of the day, you know, we minimize the risk of having dental cavities. That being said, when one snacks often, especially during the day, that increases the potential risk for having cavities. Rather than eating all of your snacks at one time, if you spread it along many points of time throughout the day, it can lead to more cavities. So we can limit the number of sweets, or make sure that you properly take care of your teeth after you have it, as well as limit the number of times we have carbohydrates, because sweets are also a form of carbohydrates, as well as rice and pasta and other foods that are rich in carbohydrates. So we can minimize those kind of foods and increase our fiber intake, so have more vegetables, more greens, more fruits. Of course, fruits are also a bit sweet, so you also you need to have that trade-off between having a healthy snack versus having a vegetable snack instead. So those are the ways that we can really take care of our teeth, apart from the general stuff I mentioned earlier, like brushing.
Okay, we have the sunnah of our beloved Prophet ﷺ, using the miswak, that is 1400 years ago plus. So as a dentist, what you say on using miswak?
The miswak, it's a good thing that you mentioned it. The miswak it's a very good habit to do and to use often, and it is the sunnah of the Prophet Muhammad sallallahu alaihi wasallam. So it is a good thing to do. I would just advise that, since sometimes the miswak, sometimes they have hard bristles and they're a bit more rough when before you really break into it. So I would recommend to just use less force when you're brushing. Like I mentioned earlier this evening, brushing is good, but brushing too harshly is bad.
Yeah.
So everything, if you do too much of one thing, it can lead to negative or adverse effects. So brushing with the miswak is very good. It's healthy. Just my only advice is to use less pressure and less force when you brush with it, as well as with the toothbrush as well. Same recommendation. You don't need to apply that much pressure. All you need to do is just brush it in a circular manner rather than a back and forth manner. A circular manner angled slightly towards our gums, and make sure that we reach every single surface and areas of our mouth.
Okay, I know it's not too late for us,
Yes.
because we're really getting old. But at least I can say is all this discomfort and pain and everything is as a result of neglect,
Yes.
as you've said earlier in conversation. So if I may ask, how can parents, let's talk about parents now who have their children, who have their kids, how can they help children develop good oral, because this is a habit, right? How can they help their children develop good oral habits early in life?
That's an amazing question. So one of the ways that parents can advise and also help children develop good habits is by first helping them brush their teeth.
Okay.
And they can start as early as when the first tooth comes out, and that's usually around 6 to 7 months. And you don't need to use a special toothbrush. All you need to do is just use your finger and use an appropriate rated toothpaste for that person, and just apply it slowly around the teeth, and make sure they spit, of course, but with children's toothpaste they lack some certain chemicals, so it's okay sometimes for them to swallow a small amount. So that's one of the first ways. The second way is to also make sure that they brush and also turn it into a fun thing. I've seen some parents use brushing as punishment. So they tell some children, their children, you know, you can't go outside, you need to brush your teeth. In fact, they should turn it around and make it into a positive thing, have it become fun, so that kids can later on look forward to brushing. They can look forward to taking care of their teeth. And once they're old enough, or once they develop these good habits, then they can start going to the dentist and do just general cleanings and checkups. One of the problems we've witnessed and faced as dentists is seeing patients who have a phobia against dentists, and they're afraid of coming in and seeing us. And this usually arises or develops from when they're young, either from a traumatic previous dental treatment, or from when they were very young and they had a bad experience at the dentist. So when children come see us in the dental clinic, we just do general examinations. If there are no issues, we just clean their teeth and they're on their way. So when this happens, they have a good experience. You know, they look forward to seeing us again. However, if they only come to us when they have dental issues and we extract their teeth, the first time they come see us, they might not be happy to come see us again. So I would advise children and parents to come see us as often as every 6 months, whether you have an issue or not. Again, as I said before, prevention is always better than intervention. So if we do things before, we can always prevent it from progressing and getting worse.
Okay, maybe I will ask you to mention it again concerning what habit, or maybe how often should I be brushing my teeth? I know you've mentioned twice.
Yes.
In terms of flossing, in terms of checkups.
Yes.
Which is important.
So we recommend, when it comes to brushing, technique always trumps type of toothpaste. It trumps, you know, all those other things. So the best technique, like I mentioned before, is to go in a circular motion. Make sure you reach all surfaces of the teeth, angled 45 degrees towards the gums, and also to make sure that you reach everywhere. When it comes to the type of bristles, toothbrushes usually come in soft, medium, and hard. we recommend either using a soft or up to a medium type of toothbrush, and we rarely advise patients to use a hard bristled toothbrush, simply because they're a bit too abrasive and a bit too rough on our gums. Our gums are very sensitive to external factors. If we use a hard toothbrush, they can recede and also get affected that way. When it comes to the type of toothpaste, the only time you can change or you might consider having one toothpaste over another is if you have sensitivity, if your teeth are generally sensitive to cold and other things, then you might switch to a toothpaste that is intended for that use.
Okay. For a person who would want to come and do checkups perhaps because you're a dentist, how can I get you or how do I reach you?
So we are located adjacent to over here Jamia Mosque on Banda Street, across from Kilimanjaro Food Court. Our clinic name is Ummah Medical Center. We have a pharmacy, a dental clinic, of which I am the head of and the main dentist there. We also have our GP, a laboratory, an optician, so we also offer eyeglasses and sunglasses as well. And we also have an ultrasound machine. So I work in the dental department in the Ummah Medical Center, and we work 6 days a week, from every day except for Sundays, and from 8 a.m. until 8 p.m. We're always available to see our patients. We also have an ongoing free consultation offer until the end of February. So please, inshallah, come visit us. Even if you don't have any issues, come sit with me, have a cup of tea with me, and we can always talk about anything else, anything that you would like.
So because you say the services are from 8 in the morning till 8 in the evening.
Yes.
So does it mean that you're from work?
Yes, in fact, I still have my clothes still with me. I also have some materials that are in the background, but yeah, we always work on and off. Of course, some evenings I might leave a bit early, but I'm always on call. So
as we wind up, sorry to cut you short because time is also not on our side. As we wind up the show, perhaps for the person who's watching us right now, what would your takeaway be as far as oral hygiene is concerned?
Our takeaway from our conversation today is, number one, make sure you always brush your teeth. Don't neglect it, please. I'm not saying that because I want money or anything like that, because if you treat your teeth correctly, then you will be seeing me or other dentists less often. But make sure you brush your teeth properly. Always consult with your dentist if you have any questions, any issues, even if it doesn't relate to the head and neck. We're always open to listen, and then of course refer to the specialist who's most recommended for that issue. The next thing would be to visit your dentist every 6 months. Please come visit us every 6 months. We always want to help you and also make sure that we can treat you as best as we can. And lastly would be to make sure you're also caught up with dental information, either by checking online and making sure you're going through reputable sources such as the World Health Organization or the American Dental Association or the National Dental Board of Canada, as well as any other country you prefer. So please always cross-check with the information you have, and at the end of the day, if you have any questions, please ask us.
Wow. Thank you so much, Daktari, for that amazing insight on oral hygiene. And I think up to that point, I hope the message is home and dry. Make sure you do checkups after every 6 months. You've been asked to brush your teeth. You also do floss. You also reduce sugar intake, and most importantly, you do regular dental checkups. Let's meet tomorrow for the Muslim Insight Show. This was Live Real Talk Show. My name is Zamzam Ahmed. Assalamu alaikum wa rahmatullahi wa barakatuh.